because she awesome. So thank you once again, Cornell, for welcoming everyone here on the Health Talk, which we host every single week, Tuesday nights at 7 p.m. Eastern Standard Time. And as we continue to build a community of health enthusiasts like yourself, we all want to encourage you to be proactive with your health. And sometimes we all need a gentle reminder, including myself, that we must place our health the top of the things that we have to do before our goals and dreams are pursued, before family, before work, because if you don't take care of yourself, you don't have the ability to take care of others, including your family. And so this week we're speaking on pulmonary fibrosis. I had a health talk some time ago on COPD. So this more in depth as to other and like an extension of that. And I want to share with you a couple of things. We may not realize it. We actually have a friend who told us that one day she was fine, and the next day she had to be rushed to emergency because she had an issue with her lungs, and then she had to have emergency surgery, and because she had pulmonary fibrosis and didn't know she had it. She had it. So some of the symptoms, signs that we take for granted may be indicators of something, that may be happening, and not to be an alarmist, just so that you can be aware. You may have a friend or a family member who may have symptoms, and you're thinking, okay, you really can't put two and two together. But as we pay attention to our bodies, how we are, how our day-to-day activities are, sometimes we have certain signs and symptoms that we sort of brush off because we're so busy living life. And so as we're busy living life, sometimes we overlook certain things. So I just want to encourage you to, as you are, and we have a friend who says this quote unquote, his name is Sachin Patel. He says, we are the doctors of the future, not in credentials, but basically with the doctors of the future, because we can pay attention to our bodies, pay attention to what we're consuming, how we're sleeping, how we're moving, how we're thinking, and how we're keeping track of what we're eating, and just pay attention to our own bodies and mind so that we can better articulate to the health practitioners that you can actually share your concerns with. And so I share that with you. This is what I've been able to do, especially with my mom's care. Unfortunately, she passed away 2 years ago, my aunt, and other things that have happened to us. And when we pay attention to these, it actually can save us. It can save us at least 10, 20, 30 years down the line. Because if we can see through someone's eye, unfortunately, they may be going through a health crisis, then we can see what we can do to be more proactive on our health. So that's what I want to encourage you today to consider. Just be an advocate for yourself. And if you're an advocate for yourself, you are heavily invested in you. And as I share this with you, I just want to encourage you to continue to thrive in your health, even if you're going through a health condition, a health scare, or the unknown, to continue to press forward and do what you can do and practice due diligence in your health. And this is what I want to gift you today. So as I'm sharing my screen with you, just give me just a moment. Let me do that. And as I'm doing this, just to give a gentle reminder as well, we do have a community on Facebook. It's called Longevity of Organo. And we have only individuals who are health enthusiasts who want to be more proactive with their health. And of course, we share different tips and of course we have these archives, some of these calls, video calls archived. So at least you can be aware, go back and, I may be sharing with you information that may go over your head, or you may not have taken enough notes, and you can go back and see the screens, the slides, the information where we get the source of information from, sorry, and that can maybe help you to sort of remember or retain what is I'm sharing with you. Because if you're like me, I like repetition. I'm a visual person. Maybe you are, maybe you aren't, and this is why I want to be able to encourage you to do as best as you can, to take as much notes as you can, or screen captures if you wish to, and we go from there. So I'm going to share my screen with you. Excuse me. And also you can feel free to place your notes if you wish to. Any questions you may have that you can put into the chat section, chat area, and you can actually, I can try to answer that for you. Excuse me. All right, let me share. And once I share this, please advise me if you can see the screen by putting a 1 in the chat. Share this now. Okay, so if you could put a 1 in the chat, let me know that you can. I would appreciate that just to make sure that you can see the screen. Okay, I'm assuming that everyone can see, so I'm going to proceed. So as we're speaking on this, we'll speak on different areas, and even though we represent a brand, I just like to be well-rounded in all our topics and try to cover as much as we can to the best of our ability, getting it from credible sources. As Cornell mentioned before, we get studies from PubMed, which is a public medical library that from peer-to-peer reviews and studies. Of course, we get things from Harvard or Yale, even John Hopkins. I get from Mayo, the Mayo Clinic. I get from other credible sources, certain organizations, for example, the American Lung Association or Canadian Lung Association or Canadian sites, where you can get all these documentation. But I kind of condense it into what I think that you would be able to grasp today within the limited time that we have, so that I don't sort of inundate you with too much information. So we know that every breath of the way counts. As we breathe in and we breathe out, that's what proves that we are actually alive. But of course, we have health issues, health concerns that can impact some of us. And so if we go through different seasons in our health or journeys in our health, we need to understand certain things. So for example, as I speak on the pulmonary fibrosis, with more specifically on lung health, but also other parts, symptoms that can impact you over time if you've been diagnosed or know someone who's been diagnosed with this condition. So what is pulmonary fibrosis? So pulmonary fibrosis is a respiratory disorder with scarring of the lung tissues between the air sacs. And so the damaged tissue becomes stiff and thickened. You can't see it, but of course, through different tests, this is what you may be advised of, is what's happening with your lungs. So this leads to your lungs being compromised or function, how your oxygen is transferred into the bloodstream. So it's impacted, you're impaired with your oxygen level, and that actually over time can get worse if not treated. Just to be a disclaimer here, there's a basically tests have been done and studies have been done to see the longevity of a person who has been diagnosed with pulmonary fibrosis. But actually, what I'm sharing with you are the symptoms of the conditions that you can actually help to sort of improve the quality of your life if you've been diagnosed with this. Of course, there's certain treatments and diagnosis that can be further treatment can be recommended for someone with pulmonary fibrosis, but I'm going to give you as best as I can the basics. And of course, as I've advised, I'm not a health practitioner, but I'm a health enthusiast, just like my husband Cornell. As I'm sharing this with you, this may ring a bell. You may have an aha moment. So the disorder that we speak about, from the healthy set of lungs to the damage and thickening of the walls with the fibrosis, and of course your intercellular gas exchange. So everything over time gets progressively worse. So there are certain things you can actually do based on what your doctor is advising you, but also what you can do for yourself, in addition to what you've been advised of from the medical aspect of that. So fibrosis is a term used to refer to scarring, as I mentioned before. And so the scarring is what actually causes the thickening. So without a known cause, because some people may not be smokers. You may have had this over time because of something else. So it's not necessarily for someone who's a heavy smoker or a light smoker or a secondhand smoking. It could be other things that could be a factor, and I'll share that with you in a second. So the progress of the disease varies from person to person. So often people who are diagnosed with idiopathic pulmonary fibrosis can live about 3 to 5 years following their diagnosis. Now, there's been studies to show that they have had an extension of their lives, more than 3 to 5 years in different studies. But there are other factors as well that can be put into place to help you, for example, like a lung transplant in the worst case scenario. So while cause of IPF is unknown, it is thought that genetics could also be a factor, not just smoking, but if you're a non-smoker and it's genetics, it could be part of that risk that you may have incurred through genetics. So when more than one member of the family has this condition, the disease just is referred to as familial idiopathic pulmonary fibrosis. Now, how do you actually damage or it can trigger lung damage? So things can happen, for example, externally, specific toxins, certain medical conditions, radiation therapy, and certain medications. So let's say someone's going through radiation for cancer. This can impact their lungs. It can impact and can trigger, pulmonary fibrosis. Unfortunately, this can happen because of all the toxins your body is actually accumulating. One of the things, for example, if your occupational exposure, if you've been exposed to asbestos and you don't realize you've been exposed to someone who's working in certain areas, like a farmer, if he's been exposed to toxins because he's fertilizing the soil with certain toxins, things like your autoimmune disease can actually trigger, this condition. And under this autoimmune disease could be things like from rheumatoid arthritis, scleroderma, things like if you're taking some drugs, if you're taking some radiation or other treatments, this can actually sort of damage your lungs. And over time, you'll be diagnosed with fibrosis. I'm sorry. So not only maybe in your home, you may have some environmental factor, things like mold, toxins, or externally outside of the home, certain things that you're using, certain agents that you're using can trigger this unbeknownst to you. And in that case, then it could be irreversible depending on what it is caught at whatever stage it is. So what causes this? As I mentioned to you, radiation and all of these types of conditions, for example, animal droppings in the environment or the workplace. The toxins released from those droppings that actually, over time, can damage your lungs, your breathing. So anyone who has been diagnosed with lung cancer or breast cancer who've had radiation, the extent of it harming other parts of your body like the lungs, this actually can cause irreversible damage, even if you've been advised to take chemotherapy. So because it's considered a poison or a toxin, your body doesn't know how to handle it, so it starts damaging other parts of your body, not just isolating the cancer cells. Heart arrhythmia medication can cause this condition. Some antibiotics can cause this condition to actually be developed. Anti-inflammatory medications. So there's certain medications have multiple side effects, and this could be one of them. So be very diligent as to what you're consuming ingesting as an antibiotic. Anti-inflammatory medication, do all of the consultation with your pharmacist, know what the adverse effects are, and then make sure you take precautionary methods to either detoxify your body as you're taking medication or decide to take an alternative other than some of the anti-inflammatory medication that are considered pharmaceuticals. So there is a necessity for medication in some cases, but of course you are the person who's consuming it. The doctor may suggest it, but you have to make that decision to either move forward with it or is to have a second consultation, a second opinion, third opinion, fourth opinion. Medical conditions can trigger it. As I mentioned, without arthritis, pneumonia can do that as well. Sarcoidosis, I have a friend who had that in the eye. And of course, she was able to consume the medication that she was given, which was prednisone, and also something else I'll share with you to take out the toxins from her body so that she didn't have any lingering effects from the medication. And she was able within a year to be able to have that reversed without any type of surgery. Systemic lupus is also can actually trigger that as well, which can trigger the deterioration of your lung, your oxygen level, your breathing, your respiratory, and of course, you've been diagnosed with pulmonary fibrosis. So pulmonary fibrosis can be caused in many cases, I mentioned before, chronic inflammation, all these things can happen. But one of the things I want to bring to your attention is the latter part of this page. There's a condition called hypersensitivity pneumonitis. I said it correctly. So this can actually develop following a heightening immune reaction. So your immune system is overactive versus normal or underactive. In this case, it's overactive. So this can cause a flare-up. where you inhale organic dust or occupational chemicals, as I mentioned before. So your immune system is trying to get rid of these toxins, but becomes overactive or heightened. So these are some of the things that we found in our studies that I've gathered information from. So the condition mostly often results from inhaling dust. So you can be breathing in contaminated bacterial, fungal, or animal products. So be careful of your environment. Wear a mask if you need to. If you're in an area that you're working, make sure that you do what you need to do with the cleansing of your sinus, getting rid of some things. If it's already internally and you're not aware of that, make sure you do as much of your due diligence to seek a doctor's opinion, advice if you feel you have been compromised with exposure to something that you think you may be at risk for in the way of your health. So in some people, there's chronic pulmonary inflammation and fibrosis develops without any identifiable cause, but they may not know where it actually triggers from. But these are some of the warnings. But some of the symptoms you may have, for example, like fast or shallow breathing. You may find you're overly fatigued, overly tired. You may have some chest discomfort for a prolonged period of time. Unknown muscle and joint aches can happen. Unexplained weight loss can happen in many different health scares and different health conditions. But in this case, if you've put all these pieces together with these different symptoms I mentioned with unexplained weight loss, that you're not intentionally dieting or to lose weight or working out, then this is also a cause for concern. Shortness of breath, including regular activities, so simply walking up the stairs or going for a short walk, or maybe walking from your car to your office or to the store, and you find that you are either coughing a lot more, you have dry hacking cough, or you find that you have shortness of breath, and that can actually be one of the symptoms as well. Other symptoms are, for example, weakness. You may have like bouts of weakness in your body, and you're feeling overly sort of limp in a sense, like you have no energy to be able to do anything in the sense of weakness. And loss of appetite could be one of them as well. And you don't have the ability or the endurance to do any type of physical activity, including exercise. Another symptom is that there's something called clubbing of the tips of the fingers and toes. So there's thickening of the flesh under the nails. So it causes it to widen and to round, like a round appearance. And this is due to low oxygen saturation. So symptoms vary depending on the cause of the pulmonary fibrosis. So the severity of the symptoms and the progression worsening over time can be a telling sign of what is happening to you internally. So most of these people who have a condition called idiopathic pulmonary fibrosis, they don't respond to medical therapy. So while some of the other types of fibrosis, such as non-specific interstitial pneumonitis, so NSIP, I have to take my time to say that, may respond to immune suppressive therapy. So that's in certain specific situations. But I'll share with you as well as we go through our slides, the different types and what we've seen and what we've been able to research could be of help to you if you or someone you know may be diagnosed with this condition. So there's different types that have been identified under the fibrosis umbrella. But I found this information through a medical hospital website where I got some information there as well. Excuse me. What can you do to be able to be proactive? Well, early and accurate diagnosis is critical. Many times it's trying to get someone to give you an accurate diagnosis. So you have to be your advocate. You have to push, because sometimes you have doctors who will seeing different type of symptoms and you may be misdiagnosed. So you may have to push to ask your doctor to refer you to a specialist or to a breathing clinic to be able to test your breathing, your capacity, your oxygen level. You can actually go to Amazon. They have this oxygen for your fingers that you can actually go to measure your oxygen. That could be an indicator that you could actually at least start there. And as you go to your doctor, you may have to wait for a specialist appointment, which may take months, but at least you're being proactive on that. And then you're pushing for that because, like I said, the doctors may say, well, I don't think you need to. Not to be an alarmist, but if you know your body, you're paying attention to your body and you're otherwise healthy, but something is not quite right, you can't put your finger on it, you need to be able to tell the doctor, I need this done so that I can actually eliminate that from my worries. So how do we understand pulmonary fibrosis? Well, there's certainly risk factors, and below I put some other um, links here as well. If you want to get them, you can share them with you separately. You may not be able to tap on the whole thing because it's a slide. But some of the risk factors for pulmonary fibrosis at your age is higher in the middle age and elderly. It's because the immune system is going down, more risk of exposure, pneumonia, and so forth. So that is a high risk factor. If you're a male, you're at higher risk than females. Smoking is a given. Former smokers who've even given up smoking for 20, 30 years, there's a risk there. People with emphysema have a high increased risk. Exposure to pollutants from workplace, you're mining, you're farming, and people who've come into a country who works directly on the farms and for a long period of time, be exposed to certain toxins unbeknownst to them. So these are things you have to be mindful of. Construction, I see people, they're doing the construction work, they don't wear like protective gear like the mask. Some people cannot breathe with a mask, but there's certain things you must do to protect yourself. Cancer treatment, you've been diagnosed with radiation or chemotherapy, there's a risk there as well. And I mentioned before genetics. So some types of pulmonary fibrosis can be hereditary and passed on through genetics, through generations, but of course, this is not always the case. So pulmonary fibrosis complication can also impact your heart. So there are certain risk factors like cardiac problems can actually arise if you've been diagnosed with pulmonary fibrosis. So it's very common with people who've been diagnosed with this condition, not realizing this is a secondary issue of your secondary concern of your health. So having a coexisting cardiac condition can affect the prognosis of quality of life or the reverse. So the organism in the body works together for it to function properly. So when one is not working well or functioning well, it can impact other parts of the body, including other organs. So the heart and lungs work hand in hand to pump oxygenated blood through the body. So if one's not performing well, of course, it's going to put a strain on the other. And this is where you may have cardiac problems that may be developed or you've had it before. You've been diagnosed with pulmonary fibrosis. So the lungs are not functioning as they should. It can affect the heart and the cardiac conditions can develop. As I mentioned before, it could be a risk factor if it's genetics. So of course, if you're in your family, if you've had one person or two persons, even if it's someone who's no longer here, maybe two generations before, and there's a conversation about, Uncle so-and-so, Uncle Tom, Uncle Jack, they may have had they've had pulmonary fibrosis in their latter years. They may have had it before, but you may not know. So if you found out in your maternal or paternal side that there is a chance that one or two people in your family have had it, please, please, please go to your doctor and ask them if you can have a test done to eliminate or to rule that out of your concern. But the fibrosis can also impact your skin. So the external part of your skin actually is the last place you will be able to sort of understand how your body internally could happen or the reverse. So you may have all these conditions that you may not be able to put two and two together to realize, okay, there's something happening with my respiratory issue function, but you may have certain skin conditions that you may not realize could be connected. So scleroderma is one thing that can actually involve the lungs, associated with greater degree of skin scarring or fibrosis. So there's new research showing that you can predict a person's risk of organ-specific complications involved in this disorder. So the skin may have bumps or actually raised skin could have an imperfection, but it's actually an underlying issue. Or I'm just trying to put these are sort of just mild pictures of what the skin can actually look like, but they're actually worse conditions. The skin can actually have more inflamed areas due to inflammation of part of fibrosis. The eye actually is also a concern as well. I know most of us may just do an eye exam just to make sure that our eyes can get the right type of eyewear for our vision, but it goes beyond that. So you've seen optometrists and they look behind the eye, they may give you that specific test to look at the tension, the pressure, the back of your eye. there are some key indicators that can identify that could be a possible risk for other things. So, for example, one of the things that can may lead to eye problem is for pulmonary fibrosis is things like excessively dry eyes, blurry vision, cataract. I know in the Caribbean, there's a lot of individuals who develop cataract, and as you get older, you can get cataract as well. But if you have other symptoms leading, in addition to this, again, that is a flag that you need to be able to raise to your doctor. So as I mentioned before, the systems and the organs, they work together. When one is not functioning, the others can be impacted or put a strain on the other. So if it's not functioning properly, then it will lead to other worse situations like further lung conditions or certain lung disease, including um, pulmonary fibrosis. Most of us, as we've been diagnosed with something, we go into a state, our mental state can be impacted. So this is no different in this particular situation. You may be diagnosed with cancer, or even sometimes you go through menopause, which is not, it's part of the change of life, or andropause for men. So those things you're coping with, as your body changes, as things happen to you, you may have a risk of developing depression. Your mental state is something you have to be aware of. You know, most people diagnosed with something that impacts their everyday activity or day-to-day life. They may have a sense of hopelessness or sadness or frustration, or they have these moments that they feel that their body is sort of leading them to further illness, so they feel that they have lost control. So depression is something you have to look out for. If you haven't experienced that, and someone is experiencing depression because they've been diagnosed with pulmonary fibrosis, I would say to you, try to understand what the person's going through. Do your own homework. Understand how you can be there for that person in an empathetic way without being judgmental, overly critical, because that person may need a shoulder to lean on to speak and to share their concerns so they don't feel that they're a burden. So depression is very common in any health scare, any health diagnosis. The feeling blues, loss of interest, not wanting to go anywhere. Normally, you feel joyful, and you feel that you find the person sleeping more, maybe more irritable, may have loss of appetite, more frequency crying crying moments, avoiding people overall, so they sort of feel withdrawn. So pay attention to those things. They can be from mild to moderate to severe. So there are certain things I can share with you for strategies to deal with depression if you're going through this particular season of your life, if you've been diagnosed with pulmonary fibrosis. Talking to a therapist, with a counselor, a therapist or a psychotherapist, or even a close friend or family member that you know, like, and trust. Not everyone in your family, whether by blood or not, that you can confide in because of the dynamic of the relationship, but lean on someone so that you don't carry it internally and cause more damage to your body by internalizing stress, which is actually a negative effect you're going to have, putting more strain on your system, on your recovery, either your journey of becoming, healthier in this aspect, best of your ability. So things like try to avoid withdrawing from your friends, having conscious decisions to be more interactive, even though you don't feel like it. Not really sharing your burdens or your cares or your concern with every person you connect with, but at least you're in an environment that'll lift you up. Exercising within your limitation, within your range, because at times you can have moments of feeling weak, or even lethargic, or that you feel really overly tired. This is something you have to do in moderation. Of course, speak to someone who can assist you in creating a workout plan, even just walking slowly, doing little things that can help you to stay, in a way of proactive with your health, but also releasing the happy hormone. We call it endorphins. It's the chemicals in your brain that help you feel better, sorry. Join a support group. There's groups online, there's groups that you can ask your doctor to refer you to. Even if you're going to a specialist, they can refer you to a support system of the right group that can help you with, certain things you may take for granted. So things like yoga, stretching, meditation, interacting with people, things that are not so high impact on your joints. If you have exactly like, for example, like pain, or chronic pain because of what you've been diagnosed with. But in addition to that, what you can do whilst you're waiting for a specialist or whilst you're waiting to see your doctor, even if you have been diagnosed or you're waiting to be told what your body symptoms are to get confirmation of that, the things you can do to be proactive, like making the right choice to eat right. You know, we tend to get stressed and we gravitate to the processed food or the things that are not good for us, which is counterproductive. Staying active as best as you can, not pushing yourself too much, but in moderation, learning techniques and coping skills of how to reduce your stress, protecting your lungs. I'll share with you how you can do that later on. Managing your side effects. If you're taking medication, there are going to be side effects if you're taking the pharmaceuticals. So be mindful of what you're consuming, what the side effects are, and how you can cope with that, how you can detox your body as you're taking your medication so that you're sort of giving your body the best care as you're going through this season of your health journey if you've been diagnosed with pulmonary fibrosis. Things you can do to prevent and manage the exacerbation, so the worsening of your pulmonary fibrosis. And one of those things is being overly stressed. Or if you have a mental decline, the way of your depression can actually come upon you. And those are things you can learn how to manage so that you don't negatively impact your health. So for pulmonary fibrosis can cause decrease with oxygen level, as I mentioned before. And one of the things it can lead to, excuse me, is individuals with that it's called pulmonary hypertension. So individuals who've had pulmonary fibrosis are frequently treated with supplemental oxygen. So you may see them with the oxygen mask or you know, a tank that they have or tube, and that's helping them to breathe better, to clear their pathway, their respiratory, to help improve their oxygen level and their breathing capacity. I mentioned before the oxygen a tracker to be able to test your oxygen level. You can actually get that through Amazon or another. I'm not advocating for Amazon, but you can actually go to Wellwise, or if you're in Canada, you can go to a health store, a pharmacy, and you can ask them if there's uh, a test, an oxygen test. They can actually put in your finger to check your oxygen level as well at home. In addition to medication or medicine, that you can think of non-drug approaches that you can use. As I mentioned, the oxygen therapies could be one of them. You could do as you consult with your doctor, so that can help with your rehabilitation. Also speak to a nutritionist, a naturopathic doctor. Speak to someone other than your pharmaceutical doctor, your family doctor. I say pharmaceutical, but they prescribe pharmaceuticals. You're going to speak to your health practitioner, but also engage a naturopathic doctor to help you put you on a proper nutrition for your body. Someone also is going to help you with maybe your rehabilitation if they haven't, you know, recommended one for you. You can actually do that if it's within your means. And so that you're being proactive and doing the right things to help you with your journey as you're going through this health condition. And also learning how to breathe, breathing exercise, breathing techniques, so that if you become overly anxious or stressed, you can have moments where you can just stop and teach yourself or actually do those breathing exercises to be able to calm yourself down and to reduce your stress level. One thing as well is to always remember to stay hydrated. I have to give myself a daily reminder. I don't have pulmonary fibrosis, but most of us, we tend to go about our day and don't consume as much water as we should. Water is essential for your lung health. So how much water do you drink? Recommendations between, 6 to 8 glasses of water or more for an average person who doesn't have this condition. So the intake of your water is very, very important, but also learning to limit the sodium on your intake. Bottled water, some of them have sodium in there. So you're consuming 8 bottles of water, 500 ml of water. That's a lot of sodium you're consuming. Of course, read the label to make sure that it doesn't have salt. Make sure you read your labels to make sure that you're limiting the amount of sodiums. Switch the type of salt that you're consuming from something that's iodized to healthier. Like, of course, Colin mentioned Celtic salt that he has in his coffee that he's consuming, which is very good for inflammation and other things. kosher salt. You can look for Himalayan salt. So choose a salt that's good for you and make sure you determine you actually do your due diligence to know where the salt is coming from. Now there's other ways of consuming sodium, but I'm just mentioning the actual salt that you're consuming. But they're hidden sodium in foods because of how foods are preserved, especially frozen foods. Make sure you pay attention to that as well. So nutrition plays a huge role to help support you, especially your lungs. It's recommended that you consume you decrease the amount of most people when they have signs of malnutrition because they're not eating the right way. They may be eating a lot of food, but not the right nutritional amount that you need to be able to sustain your body to get the right nutrients into your system so it can perform at its optimal best. So if you notice that you have a reduce in your size of clothing for unexplained reason, if you reduce your food, you've actually have unexplained fatigue, as I mentioned before, you may need to ramp up and be able to sort of double up, so to speak, on certain nutrients. So you have to maximize your antioxidant intake, enhance more lean, clean protein. Make sure that the protein you're getting is not full of antibiotics. Make sure it's not farm grown versus wild caught. Things like chicken, meat, fish. Make sure that they're not sort of fed a lot of antibiotics, which goes into your body. So whatever the animals are consuming, the antibiotics goes into your body and that impacts your body. So it can't really manage that. So be mindful of that. The right type of omega-3 fatty acids through food and through supplements, pre and post pre and probiotic intake is also important. So if you're a vegetarian, you can find other sources than the yogurts, for example, but you can find supplements that can give you those types of nutritional value you need for your body to be able to optimize your lungs, your breathing, especially if you've been diagnosed with pulmonary fibrosis. So here's some tips for food for lungs. One could be, now, if you're not a veggie person, that's okay. I've actually decided for me to get some of my maximum intake of greens, I kind of put them in smoothies sometimes. So I'm tasting, like, for example, mango, but I'm having my spinach, right, or my kale. But if you actually have green leafy vegetables, it's really good, rich with antioxidants. We know some of the foods on the planet is heavily depleted because of the soil, not enough nutrients, but other things I'll share with you can do. But just basically know that you're getting antioxidants rich in vitamin C and E and magnesium, so it's lower inflammation and relax your airway muscles. So things like fatty fish can help. As I mentioned, make sure it's well caught. Vegetarian style could be flaxseed, chia seeds, things like that. Garlic and onion. I love garlic, so you may not, but you can actually season with it. You can have it roasted. You can blend it with other things, and you get a lot of nutrients there in the way of your what you need in the way of for your body. Citrus fruits, if you can. And now some people who have rheumatoid arthritis cannot have citrus fruit because it inflames them. So be mindful. If you are asthmatic, it can cause symptoms to react. So if you're asthmatic, be mindful of the amount of citrus you're having. But things like orange and lemon, it helps with improving your immune system. But there are other alternatives as well you can consider. Turmeric, if you're able to, you can have turmeric. Some people have turmeric milk or milk alternative and have it as a warm beverage. So it aids in long detox. Now, if you cannot have turmeric, so for example, if you've been diagnosed with a heart condition or a heart murmur and you're taking a beta block, you cannot have turmeric. So consult with your pharmacist for that. I know that because of my mom, when she was taking her beta block, she couldn't have turmeric. And I know turmeric is really good, but not everyone can have it. Berries are really good to have, full of antioxidants. You saw where I was born in Canada because I love berries. Where I'm from, there's not a lot of berries, but I love berries. If you cannot, don't let the texture make it into a smoothie, right? And try to have at least once a day or multiple times a week. Apples are really good for you to have. It helps with enhancing your lung function. Beetroot is really good. You can actually saute it, get the stem of the beet. Actually, don't throw it away. My husband taught me that. You cut that up, just like how you'd have kale, wash it, blanch it, chop it up, saute it with garlic, all these things, and actually helps with, because it has nitrites and it helps to enhance your oxygen use and lower your blood pressure. So you can be creative with your cooking, right? Ginger's really good, helps to decongest the lungs. We all know this growing up, but most of us do. It's antibacterial, antiviral. If you cannot take the strong taste of the ginger, then maybe have a smaller dosage, make it a little bit weaker, or blend it with other things, or find an alternative that helps you. Green tea is full of polyphenols and many other nutrients, so it opens up your pathway, your passage, and decreases inflammation in the lungs. But green tea has a lot of antioxidants. It helps with many other things, but these are some of the tips I'm sharing with you. Some of the foods to avoid things like that will create more mucus and allergic reaction, fried and oily foods, having excessive amount. Now, once in a while is okay, but most people will have oily foods almost every other day. That actually triggers these reaction in the body. It can cause bloating, shortness of breath. Too much sweets and sugary drinks can actually exacerbate what you're going through in the way of your fibrosis. Dairy products, some do that. If it's fermented, that might be okay, but of course, test it to see how your body's reacting. But not dairy product can cause a lot of phlegm and mucus to worsen. I mentioned before processed food or food that highly have a high amount of antibiotics. Excessive salt, I mentioned that before, and of course can cause water retention. So it can affect your breathing, put too much water in your lung, and also impact your overall well-being. So I mentioned some food items, things you can do, but there's consider something as food supplements or superfoods. We know there's certain superfoods we class like blueberries, walnuts, and all of these things, but some of them may not be enough antioxidants and minerals and vitamins for you to consume to get the right amount into your system. So I want to share with you actually a few of this, like a hierarchy of all superfoods on the planet. I'm just naming about 10 here. But there's one I was introduced to about 14 years ago. It's called reishi. It's also called Ganoderma lucidum. And it is an Eastern superfood, well known for over 2,000 plus years. It's something we've been consuming for 14 years now. And I found that with our immune system and other things that it has supported it. Very rare that we do get sick in the sense of cold and things like that. But for some reason, this month, I guess because I've been going on turbo speed, I actually got a cold. And prior to that, prior to this last couple of months, I hadn't been sick in about 5 years. So knock on wood for me. But I'm not teaching, I'm doing the gloat, I'm just sharing with you my experience. But goji berries, spirulina, aloe vera, these are all great, but as on the hierarchy of all superfoods, reishi is considered number one in the world. So I'm going to share with you some of the benefits of that. I mentioned to you things like omega-3s, flavonoids, superfoods that will help with anti-inflammatory properties and so forth. But this, I'm going to name about three, including this reishi that has been known to support the immune system if it's overactive, underactive, and to help it to sort of reduce some of the inflammations in your body, but also to help your body become more pH balanced, as well as in a more homeostasis state. Just a bit of comparison, I mentioned green tea is really packed with antioxidants and many other benefits. So a single dose of the antioxidants in the Ganoderma is about 150 in the way of antioxidants in the way of the units compared to green tea. You have 54, so sort of 3 to 1. So you're getting your daily dose in your food for your energy, but you may not have the right enough nutrients going into your body to sustain, to give it what it needs to perform the way it's meant to, and to help you with some symptoms that you're going through. If you're like avocados, you need about 7 of these avocados to have 1 dose of your antioxidants for your reishi. If you're like me, love chocolate, I love chocolate, but the right kind, you need 14 of those to get the right amount of antioxidants from a single dose of the Ganoderma. What is Ganoderma? Well, it has many properties, many sort of benefits in the way of health benefits. But one of the things I can share with you, it actually helps to boost your stamina. So less fatigue, it helps rejuvenate you, it oxygenates your body, which I mentioned is something that happens if you have the reverse, if you have pulmonary fibrosis or other conditions with your lungs. It helps to naturally detoxify your body. So if your body has a lot of toxins, like you're going through radiation or you have been ingested with certain things, that are actually foreign agents into your system, into your bloodstream, into your lungs, it can help to detoxify. Now, will it get rid of all of it? It depends on the level of toxins you have in your body and the amount you're consuming. Is it a cure-all? No, but it actually can help. So everyone's body is different. What your body is telling you is determines what you're giving it. So the body doesn't lie. If you give it the right things, it performs the way it's meant to. Not only that, it improves the body healing capacity. We know that in pharmaceuticals, we cannot say that pharmaceuticals are a cure. We cannot say in what God intended as a natural remedy can be a cure, but you can see for yourself as your body's doing it, it can help support you in alleviating some of the symptoms that you may be experiencing. So I just wanted to mention that to you. So as we go through quickly the rest, we just know that it's very high in the way of nutrients, very low in the way of carbohydrates, are very rich in nutrients and can help with many treatments for ailments with on its own or in basically to complement medication you're taking on the pharmaceutical side. So we know all foods, most foods have antioxidants, terpenoids, flavonoids. Well, really she has that as well, but in uh in a higher concentration. So we know that polysaccharides are found in many foods, well, because it's considered a food supplement as well as a medicinal mushroom. So on the same both table, it actually plays a positive protective role in the pulmonary fibrosis. So it's possible the mechanism, it can improve lung antioxidant ability. Not only that, it improves the immune system, the autoimmune system. It has several antioxidants that can help with your body needing all the right nutrients that it gets from that. For example, green tea has vitamin C, D, and E, C, E, and D. So we know that reishi has this as well in and many other benefits. So it can be, according to what we've found in the research, for example, in Japan, if someone has a health condition and given a medication, they're advised to take reishi along with that, especially to have, for example, a heart condition, heart medication, they can take it so that the medication will not damage the rest of their organs, but will actually help and complement it as they're consuming it. Also really good for people who have mild to moderate depression or any way of chronic stress. It also has been known to help with the nervous system, the immune system, is anti-inflammatory. Not only that, it helps with many other things, but there are certain individuals who they become more overly depressed than others because of how the coping skills are. So it not only impacts the immune system going down, their mental state actually being impacted in a negative, this actually helps with the overall well-being. So it helps with individuals who are feeling overly fatigued, have anxious moments. It helps to relax you. So these are all the PubMed studies that you're seeing here, PMID. You can go to pubmed.gov and you can actually plug in the ID number. It's a lot of information that is given like a highlight of what each one is stated as proven, documented information. Not only that is think of it this way: if you're consuming something like a food supplement, that can help not only on the external but the internal, and you're actually feeling it over time. You are the best indicator. Your body doesn't lie, it tells you exactly how it feels. So, for example, here's a PubMed study that states post-treatment of Candida lucidum in therapeutic dosage, of course, can reduce liver fibrosis induced by a known toxin. So it's known as a hepatotoxin. So this is actually something from the external that gets into your body, and this actually can be used as a post-treatment. So we know that if your body is the oxidative stress is at a high, it actually breaks down the body. So think of your body having all these free radicals, and of course it's out of whack in the way of balance. So when you give your body antioxidants, and in this case the reishi, it actually helps to alleviate the oxidative stress that the body is actually trying to manage. The Candidum itself have different stages. For example, it goes into three stages. So the roots, rooting body is called mycelium. The fruiting body is called Ganoderma. And of course, the seeds to regenerate and more as nature intended. And they actually have all purposes for many things. But both the spores, the fruiting body, and mycelium helps with anti-fatigue. So if you're feeling really tired, as I mentioned before, this is one of the symptoms for pulmonary fibrosis. The ability to protect the organs is very powerful. So you're consuming this superfood, this supplement, this food supplement, as well as a medicinal, because that's what it's classed as. You're able to protect your organs. So as I mentioned before, if you have taken radiation, chemo, anything in that aspect, which is not part of pulmonary fibrosis, but it's giving you an idea, a connection, you're able to protect the rest of your organs as you're being treated for many things. So in this case, it's highly documented here as to what is actually helped and known to support. So I mentioned about oxidative stress. There's over 3,000 case studies on just the reishi alone in PubMed.gov. I can't go through that all with you. You'll get like a brain freeze, but I'm just sharing with you some of the things it's known to help with and documented. But I did mention before that if you have cardiac stress or cardiac disease or cardiovascular issue, it can be linked to the pulmonary fibrosis. They can go hand in hand. So this actually protects the organs, including your heart. If you've had a heart condition, it helps with some of the symptoms. Of course, oxidative stress is a big thing that can actually be detected through different tests with the doctors. And if it's too high, that actually causes your body to go in a downward spiral, progressive, rapid decline. So as we're going through all of these things, we can be mindful of some of the things that we may not be able to define in our body because they're silent things that are happening in your body. The doctors can say, okay, this is what you've been diagnosed with, this is what's happening, and you can do your due diligence. You're helping yourself in your journey of your wellness. So as I go through this quickly, and I'm just going to wrap up in the next 3 or 4 minutes, the cordyceps is another one. So there's the reishi, which is the Ganoderma I mentioned to you, the Ganoderma lucidum, also known as reishi. Cordyceps is another great superfood. It's a mushroom. Of course, in the Eastern world, it's more known than the Western world. Like in the Western world, we sort of catch up, 10, 15, 20 years later. Like, ginseng 20 years ago, we know it's really good now. Coconut oil, we know it's good now. But in the Caribbean, we know it's actually really, really good. So not only are you consuming something like the reishi, you can consume cordyceps on its own, or they work synergistically together as a synergistic way. Some of the studies we've found is that the cordyceps benefits the effects of the lung fibrosis and many other things. Now, there's something called cytokinase, if I pronounce it correctly, and it's a hormone of the immune system. So it stimulates the cell that produces this cytokine, and this actually helps with a certain kind of a reaction that causes these infections to happen. So if you're thinking of how the body works with the immune system, it helps the cells to communicate, to coordinate the responses against infection. That's how your body is created, and that's what it does. But if it has been compromised, then of course you have the negative impact. And so cordyceps helps with alleviating some of these conditions. Not only is it helping with the pulmonary inflammation and fibrosis, it helps alleviate that, but also it helps with the other areas like your lungs, your kidneys. It regulates the immune system, so sort of tonifying these organs, and also helps to reduce the level of fibrosis related indicators. So for example, you have pro-inflammatory issues with the lung tissues. It annihilates or it sort of alleviates the lung inflammation from this condition. You may think that, okay, it's a cordyceps. What is that? Well, as I mentioned to you, it's a mushroom. So it has immense health benefits. It boosts your system, your stamina, sorry, but also it has helped with your immune system and your longevity. So we're thinking of a win-win in the sense of something that has no known negative impact with any medication on the planet. So as far as all the studies, over 3,000 case studies, individuals who are taking medication can continue to take any type of supplements in these two we've mentioned, there are other medication you cannot take, things like turmeric, ginkgo biloba. All these things have negative effects depending on what you're taking. So for myself, even though I know what this information is sharing, I still consulted with a pharmacist for my mom. I still consulted a pharmacist, consulted a naturopathic doctor with my cousin who had cancer, and knowing that this is a food supplement, she could take it without any negative effects when she's going through her radiation, and with my mom when she was given the beta block. So I know it's not related to the topic, but I want to share that with you for our personal experience. So it's also known to alleviate depression, depressive behavior, chronic mild stress. It's highly and it has highly anti-inflammatory, but also antioxidant properties as well. We know that the oxidative stress can impact a normal cell. Well, so basically, the free radicals are attacking the cells. That's the oxidative stress. And then, of course, the breakdown of the cells with oxidative stress would actually can impact the rest of your system. So because you're consuming something that reduces or eliminates the oxidative stress, you're actually able to have your normal cells communicate effectively to the rest of your body the way it's meant to. So because of these properties, we know that the ability for these cells to signal and to communicate with the rest of the way it's meant to function in the body, it actually helps to protect and support that. I mentioned before anxiety, pain, depression that can be utilized, the ganoderma for that, but also for the cordyceps oral conjunction with the two superfood. The cordyceps itself helps with not just the pulmonary disease, but other lung disease as well, because it's supporting the immune system and many other things. The other third mushroom I mentioned is lion's mane. It's the new favorite of mine. Started consuming it 2 years ago, and I've noticed a big difference with my cognition. I've noticed that my energy has shifts when I consume it. I'm more alert. So imagine going through a situation where you have a health scare and your mental state is impacted, your mental energy is declining, or your cognition, your mood is impacted, and you're consuming something like this in conjunction or by itself, depending on what you decide to do, to help reduce not only your oxidative stress, protect your organs, reduce your stress, and to enhance your mood, even your cognition as you're going through this particular season of your life, if you've been diagnosed with pulmonary fibrosis or you know someone else. So the reason I share that with you is that we are a brand, Organo, that we carry these particular superfoods, but they're infused into everyday habitual items like coffee, tea, hot cocoa, and this is how we're able to consume it and get the benefit. So you're consuming the gourmet taste without the harshness or the bitterness of any of the mushroom, because normally by themselves they're quite bitter to taste. So we're a brand with a purpose. We help people create better and healthier lives through this platform. And we want to share and add value by showing you that there's an alternative that you can have or in conjunction with what you're consuming. Now, I'm saying not to do a self-diagnosis. Speak to your doctor, then speak to a naturopathic doctor and nutritionist. They know about natural medicine, and of course, you're able to get more information from us as we're able to provide you with these type of products. Ours is organically grown versus artificially grown, even that they're both classed as certified organic. Those are artificially grown in other companies. They may be a lower price, but you get what you pay for, what you're able to consume. You get all the nutrients from a naturally grown Ganoderma or reishi or cordyceps or lion's mane versus in ground cultivation with over 36 plus certification versus artificially grown, still considered organic, certified organic, because it's grown in plastic bags. You can see the difference in color, the amount of nutrients you get. How do you consume it? Well, like I mentioned before, in everyday habitual things, like for myself, I'm having my coffee, which is the Royale. This has a 3 mushroom blend in there, the lion's mane, reishi, and cordyceps. You have those. I have a new customer who loves the hot cocoa, called me and said, I love it. It helps me to sleep. So it's not the cocoa, it's not the coffee, it's not the teas, but actually these are just delivery mechanisms. They taste really good, and you get the nutrients, the benefits every time you consume it, and you cannot overdose on food. So you consume, you can have 2, 3, 4, 10 cups of beverage, and it's still getting the nutrients, and you're able to consume it and enjoy it. It does come in nutraceutical form, So we want to be able to encourage you to practice mindfulness through wellness, being positive as you're going through this health journey. But just think of it, you make one small change, one small choice can actually have a lasting impact. And this is what it actually looks like in the way of the supplements. These are considered in the capsule form vegetable casing. And they, as I mentioned, it goes into three stages. The mycelium is the root, the fruiting body is the actual Ganoderma, and the spores are the seeds, which is considered 17 times more powerful than the other two, but they all have benefits. But the most of the products you see here actually have the fruiting body, except for one, which is the one of the coffee that has the spores. And so if you're thinking of unlocking your full potential, consider one of these, trying it for at least 30, 60, 90 days, switching out your brand of what you normally consume, committing to that. Pay attention to your body, see what it does for you because your body is the best indicator. It doesn't lie. We can tell you all the facts, but until you start consuming it, there's your best testimony. So it comes in tea forms, it comes in, as I mentioned before, hot cocoa, coffees, and so forth, even in toothpaste, which is fluoride free, which we've been using for over 14 years. And if we consuming these products and with our family, if we share it with our friends, if we share it with people that we're connecting with. And for this month, I believe for a limited time, you can actually get free shipping directly to your front door or your office. If you were to buy, let's say, 2 boxes of something, or to even just ship it to someone out of the country within the US or Canada, you can gift them with a gift of health, especially if Christmas is coming up or Thanksgiving. But for yourself, the gift to yourself, gift of health, is to at least try that. Reach back to the person who invited you, and they'll be able to give you more information on that. So with that, I'd like to stop here on my presentation. If there's any questions, please feel free. I'm just going to quickly read the comments here and see what you're saying. But if you have a question, a comment, please, please, please feel free. Don't be shy. Oh, Chantal, thank you so much. I appreciate it. I saw your comments. Any other questions? Any comments? That's okay. Sometimes we're shy. I know. It's okay. It's a Tuesday. It's lovely to see you all. I'm just going to quickly check to see if there's a new question here. Oh, so you guys are wonderful. I appreciate you staying online with me. There's any feedback, if there's a specific topic you'd like me to discuss, please feel free to reach out to me. Maria actually gave me a suggestion for a topic of a friend who had a health condition, and I actually shared it and I did it. And then the week after I had an event, and the person told me that the same condition that their daughter had, and that person actually became blind because of what they had, and it was temporarily pressing on a nerve in the brain. And I shared that I had a presentation the week before, so I just shared that with them. So, adding value, being able to share with you, you could have done anything else, but you chose to be here to be able to listen. And I appreciate you and appreciate your time. So I'm gifting you back your time. Have a great evening. Blessings to each and every one of you. And see you here again next Tuesday, if time permits. Take care, my dear. Well, my dears. All right. Bye, everyone.
Thank you, Kerry-Ann. Bye-bye.
Bye, Kerry-Ann. Thank you.
Bye.